But whatever I could hear of it, it sounded extremely engaging, and it gave us a glimpse into the future of space and how Russia is participating in that massive endeavor. Okay, on to something that perhaps we use every day, almost all the time, and without which our lives would be extremely difficult. And I'm talking about Google. So what's next in Google? Google is a certain way, it does a certain things, but it has also been an engine that has evolved consistently, in tune and concomitance with the changing landscape of technology. To talk about this and give a presentation, we have with us Ms. Aparna Taneja. She's from the Google DeepMind India team, and she's going to give us a very engaging, a very promising presentation about Google and what's next for Google.
Hi. Hi. Thank you for the lovely introduction. I'm Aparna, and I lead health research efforts for Google Research, or Google DeepMind India. For those of you in the audience who are millennials like me, we actually can remember a time when technology played a relatively marginal role in our lives. Cut to 2025, however, it feels impossible to go back to that life. Technology has irrevocably changed how we communicate, shop, navigate our spaces, and even speak. In the last couple of years, the buzz around artificial intelligence has captured the popular imagination. The hype isn't overstated. As a researcher in this very space, I can tell you that force multiplier capabilities that AI will bring to our lives has the capacity to transform entire industries, be it agriculture, financial services, medicine, education, and even the outermost bounds of the known universe. But this is where I want to take a moment. When we say that this leap will be unlike any other in the past, there's one fundamental reason for it. And that is the pace of diffusion. In every seminal shift we have seen in the past, be it the telephone, television, or even the internet, each of these technologies spent decades limited to the affluent sections of the society. It took decades before devices became cheaper, networks expanded, and these innovations proliferated into the general population. AI, however, will be different. With technical infrastructures hugely expanded and mobile phones in the hands of practically every Indian, the benefits of AI will proliferate to the bottom of the pyramid instantaneously. And for a developing country, this has massive implications. It can fundamentally transform our approach to citizen services, disaster management, healthcare, and access to credit for the people who need it the most. And when we talk about India, its complexity and multifarious nature is always mentioned. This is complex because its diversity makes it less predictable. What's true till Bareilly changes completely by the time we reach Shimla. This means for any administrator to accurately govern the whole country, they need data from every district and every tehsil of the country. And the combination of high-quality data and AI-powered fine-grained insights can change how we design public policies. Imagine personalized learning experiences that cater to every student's unique needs. Precision farming techniques that maximize crop yields while minimizing environmental impact. And accessible healthcare solutions that reach even the remotest corners of our country. And speaking of healthcare, let's go a little deeper into it. Now, India is often referred to as the pharmacy of the world. We are a significant global supplier of essential medicines and therapeutics. We have the highest number of medical colleges and remain one of the largest exporters of healthcare workers in the world. Yet, our own public healthcare facilities often find themselves stretched to the limits. Despite India having the 6th largest health workforce globally and being a primary center for medical tourism due to our quality healthcare delivered at reasonable prices, we grapple with a stark reality. Despite the large and high-quality supply of medical professionals, there are too few per capita for our own vast population. And this most affects people with fewer resources and living outside the boundaries of our large cities. Think of a young mother in a rural village anxiously awaiting her child's first immunizations, or a senior citizen navigating an overloaded healthcare system to manage their chronic condition. These are everyday realities for millions of Indians, highlighting the urgent need for accessible and inclusive healthcare solutions. Child undernutrition, high maternal mortality rates, and a growing burden of non-communicable diseases weigh heavily over our communities. And this is precisely where the potential and promise of AI emerges. Not as a replacement for human compassion or professionals, but as a powerful ally, a force multiplier in the quest for reliable quality healthcare. Through collaboration and innovation, AI has the potential to transform how we deliver care, making it more efficient, equitable, and patient-centric. I see 3 key areas where AI can transform healthcare in India. Firstly, making hospitals and healthcare facilities more efficient. Secondly, multiplying doctor capacity. Sorry. And finally, in preventative healthcare. Now let's dive into each of these areas. Anyone who has ever been in a hospital will know what a massive operation they run. From coordination to patient mapping, it's a complex and intricate balance of logistics and care. AI can bring in huge operational efficiencies, whether it's digitizing prescriptions like Google's DocLens does, or managing patient records, automating follow-up reminders, and even gleaning insights from patients' health tracked over time and alerting healthcare providers to concerning trends. This can free up invaluable time and resources for healthcare workers and also make the entire process smarter. Doctors, nurses, and caregivers, relieved of administrative burdens, can focus on what they do best, healing. The choke points that once crippled healthcare delivery can start to dissolve, making space for more patients, more hope. Globally, our work with HCA Healthcare on generating nurse shift summaries using AI showcases how AI can reduce administrative burden and empower nurses to provide the critical care that patients need. In the diagnostics space, AI models can be used to interpret diagnostic images such as CT scans, MRI scans, or X-ray images. Because these models are trained on millions of such scans and data, they are equipped to pick up even the slightest of irregularities and highlight them to the radiologist or the specialist doctor, playing a huge role in accurate diagnosis and early detection. Even a less experienced healthcare provider can lean on these tools and insights to manage complex ailments with confidence, reducing errors, and saving lives. In a country where TB, lung cancer, and breast cancer diagnosis remain a challenge due to a shortage of trained radiologists in remote areas and limited screening access. AI can address these issues by interpreting chest X-rays for TB signs, aiding lung cancer screening, and assisting radiologists in interpreting mammograms for breast cancer detection, making these services more accessible and improving early detection rates. Apollo Radiology International is an example of this. They are attempting to reduce high mortality rates due to respiratory diseases and cancer using Google Cloud platforms and AI technology to support its mobile screening program. This tech supplements radiologists' expertise, not just detecting early signs of disease, but also helping healthcare professionals process more scans than ever before, thereby helping equalize and scale access to specialty services, especially in the country's remote and most vulnerable regions. Over the next 10 years, Apollo Radiology International will use these models to provide 3 million free AI-powered screenings for TB, lung cancer, and breast cancer, helping hundreds of thousands of more people across India access timely care. In fact, TB detection is being approached from multiple dimensions with AI. Salsit technology uses cough sounds. They're exploring using Google's Health Acoustic Representations Bioacoustic Foundation model, trained on 300 million pieces of audio data to help advance research and detection of tuberculosis. All of this said, the vast majority of ailments we experience are in fact predictable. There is a strong correlation between a developing country's typical standard of living, environment, and tropical climate with diseases like diabetes, cardiovascular diseases, and hypertension. In fact, health challenges like gestational diabetes and iodine deficiency for expectant mothers are again typical in warm developing countries. Further, our unique climate and ecology predisposes us to seasonal dengue and malaria outbreaks. They happen every year and are therefore predictable. In this scenario, AI can analyze vast troves of data, predicting outbreaks and identifying high-risk populations before diseases strike, empowering public health officials to intervene early and effectively. For example, Arman, which has been dedicated to improving maternal health outcomes across India via mobile outreach, is using AI to help new and expectant mothers stay engaged with information vital to their pregnancies and the health of their babies. Using Google's AI-powered predictions, health workers are able to follow up with women at risk of dropping out of this health program. In the medical research space, AI can hugely accelerate research by rapidly processing the enormous data sets required for breakthroughs in areas like gene editing, genome sequencing, potentially leading to faster drug discoveries for life-threatening and as yet incurable diseases like AIDS, cancer, liver cirrhosis, and a host of newly emerging autoimmune disorders. From easing the burden on our healthcare professionals and empowering them with advanced diagnostics, to enabling timely, proactive interventions through data analysis, AI is poised to make healthcare more efficient, accessible, and patient-centric. The true measure of success, however, lies not just in the technological advancements, but in the tangible impact it has on people's lives. The young mother receiving timely care for her child, the senior citizen managing their health with ease, the communities protected from preventable outbreaks. These are the stories that will define AI's impact on India's healthcare landscape. While AI is not a magical bullet, It offers a powerful set of solutions to address India's healthcare challenges. By harnessing AI's potential responsibly and ethically, we can create a future where quality healthcare is not a privilege, but a right for every Indian, regardless of their location or circumstance. Thank you.
Thank you, Aparna, for that amazing presentation and that insight into what